Hello everyone, welcome to class. Today we're going to be talking about a class of antibiotics called lincosamides. This includes the drugs clindamycin and lincomycin. Today we're going to start with talking about the action of the drug. And the way these drugs work is that they inhibit protein synthesis in the bacterial cell. What that means is that, like all living things, bacteria, they have certain processes that they need to survive, and just like our cells, they make proteins. And the way that that happens is inside of the nucleus of the bacteria. Here we have the nucleus. The RNA is transcribed into mRNA, messenger RNA. The messenger RNA then travels through the cytoplasm to the ribosome, which takes in that messenger RNA and reads it. And what it does by reading that messenger RNA is that it creates proteins, which fold up and go back to the cell. This is where this drug comes in. So the drug interferes with this reading of the mRNA. And so when these messed up proteins that weren't read correctly and weren't made correctly go back to the cell, they kill the cell because the cell doesn't have the proteins that it needs to survive. Next, we'll talk about the uses of this drug. This drug is used to treat both gram-positive and gram-negative drugs. This drug is used to treat very serious infections that erythromycin and penicillin have failed to treat because of its toxicity and its penchant for terrible side effects, which we will get to when we talk about adverse reactions. This can also be used as an adjunctive therapy with other drugs if one drug has not worked. Moving on to adverse effects. So some of the more common adverse reactions are going to be things that involve the GI tract. So things that we've talked about a lot, like nausea, right? It's a very common side effect with most antibiotics. Nausea and vomiting. Esophagitis, which is just inflammation of the esophagus. We have abdominal pain and diarrhea. Outside of the GI tract, we also have skin rashes, and the severe side effects include something called blood dyscrasia or blood dyscrasia, which is any issue that involves the blood, the bone marrow, or the lymphatic system. Draw a little lymph node over here. And sometimes the cause is not known of this blood dyscrasia. Now, on to who we do not want to give these drugs. We're going to start with the most common one that is true for pretty much any drug that you're going to give. I can't think of one that you will give if they have this reaction, this contraindication, which is hypersensitivity or allergy to the drug. The second contraindication would be if they are being given the drug risopride or an antipsychotic. Be careful of the interactions with those. The last contraindication was going to be not birthday cake. I'd be really sad if you couldn't eat cake on this drug. But no, you're not going to want to give this drug to patients who are under 1 month old. Not 1 year, 1 month. There we go. Perfect. Now we're going to move on to patients you want to have caution with when you're giving this drug. Patients you want to monitor a bit more closely. And to start that off, you're going to want to be cautious giving this drug to anybody who has pre-existing GI problems. So things like Crohn's disease, IBS, anything like that. Celiacs, intolerance, anything. Second thing you're going to want to do is kidney disease or kidney impairment. The third thing is liver impairment. The last thing you're going to want to watch out for is a condition called myasthenia gravis. Myasthenia gravis. This is a severe condition that interferes with the connection between the nerves and the muscles of your body. Signs and symptoms of this are like weakness and facial drooping. Last thing we're going to talk about today is going to be interactions, drug interactions. Now, there's only a couple of these, but the first one is antacids. So things like Tums that are aluminum-based. Aluminum-based antacids are going to decrease the absorption of lincosamides. So you're going to want to give the antacid 1 hour before or 2 hours after administration of the lincosamide. The second drug interaction is going to be neuromuscular blocking drugs. These are used for general anesthesia, and this is because they increase the action. Well, lincosamides increase the action of these neuromuscular blocking drugs, which simultaneously decreases lung function and respiratory drive and can end up being fatal. Thank you for tuning in to this